Now, this isn't, this is about averages. So it's about the entire population. So 1 to 1 essentially means that it's just a steady state. One person transmits it to another. Now, when you have an R naught that is greater than one, uh, you have one person transmitting it to multiple people on average. And so the disease is growing, it's spreading at a faster rate. Right now, Arizona is at, I believe, 1.22. This was referenced in an Arizona Daily Star article. And that's the figure that is related to being the highest transmission rate in the country. That's really what they're looking at. You can look at data like number of new cases, number of hospitalizations. And while that's an important figure, it doesn't really reference what the rate of transmission is. And Rebekah, can you explain R naught with reference comparing COVID to something like the Ebola virus?
Yeah. Well, I think one way to think of it is if you're looking at hospitalizations and you're looking at testing, that's very much like a snapshot. It tells you how things are right now. R naught is one of the more useful numbers for looking forward in the future. If you have an R naught of around 1, where the average is one person spreading in this case, to about one other person, um, and you're looking at linear growth. You're looking at pretty straight lines. When you go over that, and in Arizona currently, it's I think, I'm sorry, I said it was. I can't see the numbers, but I believe it's 1.2 currently in Arizona.
Yes.
That's when you start to see exponential growth. And when you have an R naught that is higher than 1, you know that in the future, your testing and your testing rates and your hospitalization rates will be growing, will be trending up instead of trending down. COVID is dangerous, and for a number of reasons, including being highly infectious, having a higher R naught than usual, and also having a long infectious period and a fairly long delay between contact, between infection and you can be quickly infectious and but also have a symptom delay. So there's a long period in there where you might not be feeling sick, but you might be infectious and spreading the disease. If you compare that to something like Ebola, which is a really terrifying disease in a lot of ways, Ebola has a pretty fast symptom onset and a pretty low R naught. It is considered one of the reasons that we have not had more problems with Ebola, to be fairly blunt, is it kills the host before the host can spread it very fast. So it has a low R naught. It has low community spread potential. The onset of very quick, very severe. The person knows they're sick, knows they're very sick, doesn't want other people to, and either doesn't want other people to get it or is quickly in a position where they can't spread it. With COVID, you can be infected and you can feel fine sometimes up to 14 days afterwards before the symptoms onset. And if you and community in social distancing and stuff can be really important, because you might have up to 14 days where you're feeling fine, but you're communicating the disease to other people, and that contributes to the R naught being high. That contribute, and that sets. That's why we have these exponential curves over time, and the disease spreading quickly through the community and getting worse over time. Whereas something with a low R naught number like Ebola, you have a spike, and the outbreaks don't last as long.
And one thing I want to add with that is that many local governments, state governments are using the R naught value as a benchmark for when closures will end. So it's a very important number. And really, we should be seeing a lot more reporting on R naught as opposed to just the raw numbers, because looking at raw numbers just doesn't give you the same kind of information on its rate of growth. Okay, go ahead. Go ahead.
All right, something like a hospitalization number may be a little bit incomplete. If you have a low number of hospitalizations but a high R naught, it tells you that right now things are fine, but that 10 to 14 days from now, when if community spread is high, hospitalizations will be jumping in about 10 to 14, in 10 to 14 days as people have symptom onset. Or on the other hand, you might have, so COVID is being associated with, in some cases, some very long hospitalizations. People spending, there's people who have spent long periods of times on ventilators or in hospitals recovering from this. So hopefully at the end of COVID, when that comes, we may see hospitalization. One of the first signs that things are turning around might be the R naught levels dropping. Hospitalizations might still be very high because of the severity of people's symptoms, but we might see the R naught number coming down before we see fatalities, ahead of fatalities and hospitalizations dropping.
Okay. We're going to transition now to talking about Dr. Cleven and some of the specific issues with COVID in Arizona. I wanted to throw in an anecdote. I know someone here in Tucson who had to visit an emergency room on Friday night, in the middle of the night, and they went to several facilities in Tucson, and they were just completely packed. The waiting rooms totally full, and in some instances, there were lines going outside, and I'm talking about urgent care, emergency rooms at hospitals. Now, she was finally able to get some treatment. She ended up being okay, so that's good news. But she was told by one of the hospitals that there was an urgent care facility, a well-stocked urgent care facility with plenty of the correct equipment. It wasn't a trauma situation, but there was a facility in Tucson that was actually refusing all patients with any COVID symptoms. And so she was able to get in there. There wasn't anyone in the waiting room. So she got that treatment. So it is good to know that while these hospitals and medical facilities are being slammed with patients, there are certain facilities that are taking people with issues like a broken bone, for instance, something like that, where normally they'd be having to wait in a waiting room for who knows how many hours. I mean, with lines going outside. So we're going to talk a little bit about Dr. Cleven. He is based in Yuma right now. He was working on COVID treatment in New York earlier this year, but he moved and brought his family to Yuma, Arizona, which is on the border between California and Arizona, very close to the Mexican border. There's a great, huge retirement community there in Yuma. So I'm going to start out by showing some videos here, excuse me, of Dr. Cleven. This is something. Let's see here. Can you guys hear audio here? I'm going to try to make sure that is working. Might not be hearing that. I'm going to try to fix that in just a moment. While I'm working on that, Rebekah, can you, while I'm working on the audio here, can you talk a little bit about Dr. Cleven? Give me a little bit of an update on who he is and what he does.
Yeah, so he is coming out of, he's got a military and medical background. He was in New York this spring and then did the first wave here in Arizona, I believe at Yuma. He did first on social media and then was talking about the capacity the impact he was seeing of COVID on the capacity of the hospital that he worked at. He was first vocal on social media about that and then did interviews with local, regional, and national outlets. And then I believe first said it on social media and then had regional news coverage that he had been fired for making those statements. Yuma Regional then said it had been a misunderstanding. He said he had been put on the schedule but told not to come in. And I'm actually was checking to make sure I was describing his background correctly. And it looks like he is back at work so that has been figured out with the hospital. But he has been controversial because of talking about what's going on at the hospital. Covering COVID has been kind of a unique challenge. Is in charge, we've seen differences in how there's not a lot of regularity in, for example, national briefings and state briefings vary wildly according to state. So it's been a challenging thing to cover. With any kind of medical situation, uh, healthcare workers are going to need to be very aware of HIPAA, which they have been, and hospitals are very protective of patients. Right? There are a lot of ways. There's precedent for a public health phenomenon. There's ways to.
Okay, we're having a little bit of trouble with your audio right now, Rebecca. So I actually figured out the issue,
Oh,
the video issue with Dr. Cleven.
perfect.
So I'm going to switch to that. Let's see here. Okay. All right. Here's the video, a recent video of him on Twitter.
Yes. Mm-hmm.
Okay, that was from his Twitter feed. I'm going to cut now to a different video where he was with. It's actually this video is put out by the Biden transition team. So I'm going to switch to this one here. Hopefully, you all can hear this. So,
And just so
okay.
you, I'm not here. Just so you know,
Oh, sorry. Go ahead. Go
video,
ahead.
for some reason the audio isn't coming through on this side. I can hear
Okay.
you.
Okay, okay. Yeah, it looks like we might not be able to hear this one, but the Biden transition team just released this video. This is what you're seeing right now. Biden actually called Dr. Cleven, and you saw a little clip there of him. He's actually an Iraq War veteran. Did a lot of trauma work in the war there. So he has plenty of experience when it comes to dealing with a major crisis like this. So, okay, I will switch back to
In Arizona, this
yeah.
means that he's covering what for him has been he's covered one wave of COVID in New York, and this is his second here. So he's technically kind of covered three COVID spikes, two of them in Arizona.
Okay. How has Dr. Cleven been so outspoken? What makes this so unique? Why has it gotten so much national attention?
Well, I think one of the things that's interesting is that increasingly we are seeing it may not be as unique as it would be in the past. Normally, healthcare workers will speak um, through their PR departments or something like that. Like the hospital administration might connect reporters to healthcare workers, and there's kind of a unified approach to how something's being covered. We're not seeing that in this epidemic. We're not seeing the same kinds of briefings between the media and businesses, or between the media and governments, as we might be used to in other kinds of public health situations. And what I've been noticing is, especially since Thanksgiving, and actually going up to Thanksgiving, an increase in individuals using their social media, in nurses, healthcare workers, other people who are dealing with this are using social media to speak out, and talk about what they're seeing, because they're not seeing their experiences get covered in the news. And it seems like that might have been the case with Cleavon. He went on social media first and talked about what he was seeing, and then responded to requests for interviews. And that's something that we haven't seen in a lot of public health care situations before, but we're seeing it more and more happen with COVID. And it'll be interesting going forward.
So tell us a little bit about HIPAA, and because some doctors, some medical professionals, state officials have said they can't really talk about what's going on, the details with COVID because of HIPAA. So can you tell us a little bit about that? What it means, what it's for, and why are some medical professionals being misleading when they say they can't talk about COVID at all because of HIPAA?
Well, HIPAA is an abbreviation for a policy that protects patient privacy, and it is U.S. It's national policy, so it covers Americans, but won't, doesn't for countries outside of the U.S. Like if we're talking about New Zealand or Taiwan or South Korea or European responses to COVID, HIPAA won't be applicable, and it protects individual patient privacy. So my medical records, Eric's medical records, your medical records, our personal information is protected under HIPAA. HIPAA does not prevent people from talking about coverage trends. For example, the Arizona state level data that we're talking about does not compromise individual patient privacy. And that data is broken down on geographic issues so that we can, for example, compare Maricopa County to Pima County or Phoenix to Tucson, or different areas, or if we want to look if different age groups are being impacted disproportionately by COVID or stuff like that, that can be done with protecting patient privacy and without compromising HIPAA. There's precedent for that. If we couldn't do that, we couldn't really talk about any kind of public health issue. So there's definitely ways to talk about trends and community effects of in this case, COVID or other public health situations without violating HIPAA. There's absolutely ways to do that.
Okay. Well, we're going to wrap things up here today. That's your update for Arizona. Arizona's, like we said, it's currently big in the news, and how the state is dealing with COVID is unique, and you just don't see that many closures. There is no statewide mask mandate. So we will definitely continue in the next few days updating you on this, especially with it being a national issue. So thank you all for watching. You can subscribe to our different Twitter feeds with HAPS. You can also donate their sponsorship options. It's a great way to support independent journalism. You don't have to worry about the money that you spend on your media trickling down to the reporters who are actually reporting on this. Your donations, your financial support goes directly to us, to Rebekah and I. So it is a wonderful way to support us. And when you support us, it keeps us coming back. It gives us an opportunity to continue reporting. It's a great way to connect with us. And also, a great thing with HAPS is that you can comment, you can ask questions in the feed. So it really is a revolutionary way of dealing with news, consuming news, reporting news, and we really appreciate it. There are plenty of options for the sponsorship, and we really appreciate you for watching. And we'll be back soon. I often will post flyers on my social media that show when the broadcast will be. So thank you all for very much for watching this HAPS broadcast, the Network of Now.